Hi, I'm Dr. Paul with Car Injury Care TV, and we're talking with Dr. Nick Venturino, and we answer common questions about auto accidents, medical, legal. And the question that we're talking about today is whether or not you should sign an early settlement with the insurance company when they call and offer you an early settlement. So we're talking with Dr. Nick Venturino. And what's your opinion of that, Dr. Venturino?
I think it's always a bad idea, always.
And it is pretty common now, isn't it, after an accident, that the insurance company will immediately call the patient and try to get them to settle for kind of pennies on the dollar, isn't it?
Absolutely. And the sooner they can get a hold of you, the better.
You mean the insurance company?
Absolutely. The sooner the insurance company calls you, the better it is for the insurance company.
Right, right. And essentially, what are they trying to do?
Cut their risk for loss. They know if they can talk to you early, even maybe before your pain is really set in or it's mild, they can explain to you, well, it's probably, a little muscle strain here and there. They're not doctors, but they're playing the role of one. And then, hey, you've had this problem. Let me just give you $1,000 or $1,500, and it should cover everything you need and still put a little money in your pocket for your trouble. And you see this, I see this a lot with younger adults that, I'm not really hurt that bad, I'll bounce back. They cash that check, and then 2-3 months later they start having problems that they can't explain. Then they don't have any insurance to cover that.
I could see where that could be enticing.
Absolutely.
For a patient who doesn't necessarily feel at that time
Exactly.
that there's much of an injury, they get a phone call, and what are some of the complications? Let's say that happens. How does this play out in that patient's life relative to that injury? What are some negative aspects of somebody that settles early with an insurance company? How does this negatively impact them?
The minute that they sign their paperwork, they release the insurance company from any and all liability. So if they need any follow-up treatment or any treatment at all, they have to pay for it out of their pocket.
Is it, in your experience, do the patients know that? Or
No.
So they don't.
The less you know from an insurance company's perspective, the better it is for the insurance company, because again, the idea is to cut their risk for payment. So if they know you've got car damage, we'll give you a little money to fix your car. We don't know if you got any damage to your person, so we'll give you a little money for your trouble. But if they didn't, and you did have some problems a week, 2 weeks, a month later, they don't have to pay for any of that. If you miss time from your job because of these problems, they don't have to pay for any of that. So there's a multitude of things that can crop up that the insurance company has literally just washed their hands of because you signed away your rights to follow up with the insurance company. So you pay your premiums every month to have coverage, and then that person signs away their rights to the benefits for that because the insurance company catches you at a pretty naive moment.
Mm-hmm. And have you experienced that with patients? Have you had patients come in who have signed early releases?
Just last week, I had 2 young girls at USF that were in an accident. One of them came in for treatment. The other one, she's 21. I don't feel any pain. And she signed. I think she got about $900. She thought she hit the lottery. And her friend was coming in for treatment. And this was just last week. So here we are, the first part of this week already. The patient calls up and says, hey, my friend's doing a lot better. All of a sudden, I'm starting to have headaches. I'm restless at night. I'm not sleeping very well. Can I come in for treatment? So, of course, at this time, we find out she settled her case 2 days or so after the accident and find out she's got no benefits. Well, she doesn't have any health insurance as a student, so she's having to pay out of pocket for this, and she just simply can't afford it. So she just has no access to health care or no way to pay for it.
So that's not uncommon for somebody who's in an injury and an accident not to have immediate symptoms right away.
Very common.
Maybe a few days or a week so later. And then they may sign off not thinking there's anything wrong, and they just sign away all their rights. What is the likelihood, like in that example, that this person can turn that around, or is it over? She's just lost all her rights relative to her insurance coverage.
It's a contract that you're signing. So when you sign to get auto insurance, they're contractually obligated to protect you if you have a loss, if you have an accident. When you sign away those rights by taking settlement, you've given up any and all rights to any of that contractual benefit. So you're basically saying you'll take in her case, the $900 and you can keep those benefits, I don't need them. Well, when she finds out a week or so later that she's starting to have problems, well, that $900 is all she has for treatment. And if, God forbid, she needed an MRI, $900 is gone right away.
Right.
So,
So it sounds like, relative to the injuries, you're just out of luck then. There's no way to turn that around. Is that right?
I
mean,
agree.
that's that.
yes. And
Even if they get an attorney,
no attorney will take them.
Oh.
No attorney will talk to them.
So once they sign that, then the attorney won't even deal with them either.
Correct, because there's no legal remuneration whatsoever. There's no recourse from your
Okay.
attorney.
Okay, so that sounds like that's real bad news then when
It-
they sign an early
You can almost look at it as predatory. They call you to see how
It
you are
sounds
doing.
like it.
And then as soon as you tell them, well, you know, I'm doing okay, I haven't been checked out by a doctor or anything, but I feel all right. Let me give you a little money and we'll make all this go away. You'll put a little money in your pocket, knowing that the odds are 3 weeks, 4 weeks down the road, you're gonna start to feel
Are
some
there,
things. But by then-
that does sound predatory. Are there any laws that are coming down the pipe to kind of prevent those types of actions? Do you know of?
To my knowledge, no.
No.
It's you know, the way it's presented is the insurance company is trying to make sure you're okay. Make
Okay.
a follow-up call, because they heard you had an accident.
Right.
And you decided, no coaxing, you
I
decided
see.
you'll take a little money for nothing.
Right.
And the problem is you haven't been evaluated by a professional to tell if you have any problems, not just pain, but problems. And now you've given up all your rights.
I would say. So I guess the bottom line is, what's your recommendation for somebody who is thinking about signing an early settlement?
You need to have an examination and make sure that you don't have any injuries with or without pain, especially in the beginning. Make sure you don't have any injuries before you give up your rights to get treatment for those injuries.
And if somebody did sign that prematurely, will you still work with them and help them?
Absolutely.
Okay, but you just got to work around it now, it sounds like.
Correct. And we've got to just figure out the financial aspect of it.
Okay.
Because
Okay.
the insurance won't cover it.
All right, we're real good. Again, this is Dr. Paul with carinjurycare.tv/North Tampa, and we're talking with Dr. Nick Venturino. And again, we have over 50 other videos you can get of common car injury questions and answers. You can head over there right now and pick them up. They're the most common car injury questions and answers. It'll help you a lot if you've been in an auto accident or a friend or family member has. It's carinjurycare.tv/North Tampa. Go over there and we'll see you over there. Take care. Bye.